So hello everybody, welcome back to the platform of Unacademy. And today, because it is the last day to prepare anything and to listen to anything, we are going to discuss a very basic topic so that you guys feel confident and there is no worries related to the exam. So we are going to only discuss very basic one-liners from pediatrics. So it is going to be just a marathon revision for all of you so that you feel confident for your exam and there is no worry before everybody heads towards the exam. So today we are going to start discussing about the most common things in pediatrics, which is like simple one-liners that can be asked in the exam to all of you. So I don't expect that anybody should be stressed right now. Anybody should get palpitations. Anybody should feel that you do have forgotten something. So it's a very simple discussion and a very simple session that we have so that all of you are confident with my subject. And just before starting the session, those students who are still targeting and preparing for the next year's NEET PG exam, for those students, I would like to inform you that it is highly advisable and a recommendation from all of us and especially from my side that please come and subscribe. So if you subscribe, it is going to help you buy time for yourself. Always in my session I say that it helps you to buy time for yourself. That means अगर आप subscribe करते हो तो आपका बहुत ज़्यादा time and effort save होता है. ठीक है. Time and effort is saved because you don't have to travel here and there. You don't have to read hundreds of books from here and there. You don't have to do anything. You get everything that is required for the exam from one simple platform, that is Unacademy. Because it is totally online, it is going to be very efficiently time saving for all you guys. And time is what is most important in a competitive exam. So if you take a plus subscription, you get to attend all the live and recorded classes. You get to learn obviously from the top educators. You can compete in the live tests and quizzes. You can study on the device of your choice. You can access more than 25,000 plus questions. So this gives you a lot of exposure to all the clinical kind of MCQs and everything that can be framed for your upcoming exams. And those who take it for 12 months or more also get a handy set of printed notes. And to add it on, those who are subscribing before 11th of September, that is very near now, just one day is left. So if you do that, you will still avail the benefit of getting the printed set of notes with your plus subscription. Beyond this facility or this boosting up is available only with the iconic subscription. So those who are members of the iconic subscription would get that benefit, but plus also will get the benefit if you take it before 11th of September. So iconic subscription is a combo subscription, which is a combination of Unacademy and Prep Ladder. So if you take it, it is going to be very useful for all you guys because it gives the benefits of both the platforms. So from Unacademy, you get to attend the live classes, you get to attend the recorded classes, you get to solve the question bank of 25,000 plus question. There is live tests and quizzes, and there is also the provision of having digital set of notes. From Prep Ladder, again, you get all the integrated essentials, the video lectures, the question banks, the rapid revision courses, and the dream notes. So Iconic is by far the best selling subscription that we guys have to offer for you. So those who are preparing very seriously for the NEET PG 2022 or 23, please come and take the subscription so that we can also help you to prepare very nicely, because whatever content we prepare, whatever things we try to teach you, it is all very nicely prepared. So we want to offer this to most of the candidates so that you guys can prepare very easily and at comfort for your upcoming exams. So if you're a subscriber, you get to attend anything and everything that we have for your exams. So the last 1 month package that was there are very few things to do now because the exam is so close. So I hope those who have attended the grand test have been able to perform and understand and exercise their brains and must have done really well, so that it is going to help you perform nicely on the main exam also. So this final bout which was announced, that must have been a good experience for all of you. So those who are planning to take the subscription, please take it for 12 plus 2 months because we have this offer still valid. It adds 2 months of free subscription to your course. That means whatever course you have taken, you can access it free of cost for additional 2 months. So जो भी चीजें छूट गई हैं आपकी, anything that you have not studied properly, anything that you could not understand, you want to reread it and re-exercise, you can do it in this 2 months extra subscription period that you get. The best plan that we have is a 4-year subscription plan. So 4-year subscription plan mein we have got both Plus and Iconic. For Plus it is 60,000, for Iconic it is 75,000. So under this, the best benefit is that you get a complete structure for your MBBS exams, that is your prof exams, plus you also get it for your NEET PG exam. So complete preparation that we need to offer you for your complete curriculum, that is possible if you take this subscription or 4-year course. Okay, so this is the subscription that we have the benefit for, which just one day is left. So all of those who are planning to take the Plus subscription, I hope that all of you are aware of this, and we are offering free Unacademy printed notes with the Plus subscription. Otherwise, beyond 11th of September, this thing is going to be available only with your Iconic subscription. So those who want to take the Plus subscription and also avail the benefit of having the printed set of notes, please come and subscribe as soon as possible. Whenever you subscribe, you can use my code, which is very simple, Kavita S10. If you put down this code, you get additional 10% discount, which is above the discount that Unacademy is offering you. So you will get a printed set of notes, which can be very, very useful for all your exam. To sum it up, we have Plus and we have Iconic. Whenever you take it, please take it for ample duration of time so that you can revise everything from the same source. Whenever you take the subscription, please use my code. It is Kavita S10. With this code, you can unlock all the special classes that you want to attend. I'm soon starting nephrology and neurology. So these are the 2 units that I'm planning to complete in this month. So all of those who want to study the complete unit from me, so please use my code to unlock the special classes on Wednesday. And also you can use my code to take the Plus subscription so that you can complete the whole unit properly with the Plus hours. So Plus subscription offers you a lot of benefits. So those who want to study in a continuum in pediatrics with me, so you can take this subscription so that you guys can be a part of the Plus hours also. Okay, so starting with today's topic, very simple and very friendly topic that we have. It is a simple, most common series in pediatrics. So it is very simple. All I want all of you is to just listen to the question, and whatever comes to your mind first, you have to start to type in the chat box. So if you do that, you will be able to check your recall speed, you will be able to revise the chapters properly, and it is going to be very, very useful for all of you to prepare the last mile towards your exam. So it's a complete revision of pediatrics. The best that I can offer today in the evening is to help you revise the complete pediatrics course in just these simple one-liners. Okay, so let's begin. Which is the most common lysosomal storage disorder? So I've already taken plenty of classes on metabolic disorders. So which is the most common lysosomal storage disorder? Very simple answer. What would you answer? Please type in your chat box. Take it like a game. Just feel free and try to answer. There's nothing to stress out. Those who are appearing for the exam and even those who are preparing for next year's exam, it is very simple. So whatever comes to your mind from whatever you have read till date about pediatrics, you just have to start typing in the chat box. It's not a competition. It's not an award-winning session. It's neither a punishment. Just feel free to answer. It's just an interactive class. So we can discuss as much pediatrics as we can in 1 to 1.5 hours, maximum 1 hour, because it's exam day time right now, so I don't want to stress anybody. So what do you think is the most common lysosomal storage disorders? सबसे commonly क्या होता है? Please type in your responses in the chat box, those who are listening to the session. Okay, so if I give you options, is it Niemann-Pick's disease? Is it Gaucher's disease? Is it metachromatic leukodystrophy? Or is it Fabry's disease? What would you choose now? Please type in your responses in the chat box, those who are listening. Any guesses? Which lysosomal storage disorder occurs most commonly? Anybody who would like to guess out of these four? I've given you good enough options also. Which could be the most common lysosomal storage disorder? So basically, lysosomal storage disorders are many of them, but most commonly and overall also, which is the answer, it is Gaucher's disease. Okay. So Gaucher's disease is the most common lysosomal storage disorder that you should be aware of. ठीक है, Gaucher's के लिए क्या क्या important है? Gaucher's disease is a multi-system involvement. It involves your reticuloendothelial system. It also involves the hematological line. It also involves your skeletal system. So you classically get hepatosplenomegaly. You would also get a classical wrinkled tissue paper appearance on your bone marrow aspiration, and in your skeletal part there is dilatation of the ends of the bone, so that gives a classical picture of Ehler-Meyer flask deformity, which we have already discussed many times in image based questions in your x-rays and also in the spotters. Okay, so most common lysosomal storage disorder is Gaucher's disease. Okay, next question. Which is the most common cyanotic heart disease? This everybody must be knowing. If they specifically ask you which is the most common cyanotic heart disease, then what is going to be the answer? Cyanotic heart disease. We have read all the T series disorders. So T series disorder includes tetralogy of Fallot. It includes your TGA, TAPVC, truncus arteriosus. So which is the most common cyanotic heart disease that occurs in pediatrics? Anybody who would like to answer the most common cyanotic heart disease in pediatrics is? So out of all the cyanotic heart diseases that we have discussed, the most common is tetralogy of Fallot. That is TOF. So TOF becomes the most common cyanotic heart disease that is present in pediatrics. Okay. If they had not put cyanotic and you had only got the answer question as most common congenital heart disease, then your answer becomes VSD. Overall, VSD is the most common congenital heart disease that we have. If you don't have VSD, and they specifically ask you cyanotic heart disease, then your answer should be TOF. Okay. All right. Next question. Which is the most common heart disease in infant of diabetic mother? Now, this is a very confusing question because there's a lot of controversy about three options, that is VST, TGA, and hypertrophic cardiomyopathy. So please remember, whenever they ask you the disease, so answer to disease part has to be VST. Most common is VST. Most specific, if they ask, it is TGA, and transient disorder is hypertrophic cardiomyopathy because it is only due to the insulin action that occurs on the infant's heart. Okay, it is not going to remain in the infant further after the birth. It is only caused due to the transient action of insulin on the heart of the baby. TGA is more specific, but VST is the most common heart disease that is seen in infant of diabetic mother. Is it clear to all of you? Okay, next question. Which is the most common cause of early onset neonatal sepsis? Which organism is the most common cause of early onset neonatal sepsis? Which organism in India and overall also is most common cause of early onset neonatal sepsis? Can you name the organism which is most common for EONS, that is early onset neonatal sepsis? Obviously, it is going to be the organism that is infected from the mother's genitalia to the newborn. Any guesses for the same? So, most common organism in our setup and overall also, which leads to early onset neonatal sepsis, is group B streptococci. Okay, so group B streptococci is the most common organism that leads to early onset neonatal sepsis. Okay, most common cause of myocarditis. So, which is the organism that is most commonly responsible for causing myocarditis? Which is the virus? And one clue that I can give you, it is a virus, which is the most common cause of myocarditis. So myocarditis is mostly caused due to viral etiologies. So what would you mark as the answer? What comes to your mind first when I ask you the causes for myocarditis? Anybody who would like to type in the chat box? Any guesses also? So this is the reflex that comes inside your head when you read something that you have already read before. So if you have read any of these topics in detail, you should immediately come up with the answer. Can you name any organism that causes myocarditis in pediatrics? And out of these, which virus is most common to result into myocarditis? Any guesses? The most common virus that causes myocarditis is Coxsackie virus. Okay, it is Coxsackie virus that is well known to cause myocarditis in pediatrics. Okay, so again, let us revise. Most common lysosomal storage disorder is Gaucher's disease. Most common cyanotic heart disease is TOF. Most common congenital heart disease becomes VSD. Most common heart disease in infant of diabetic mother is VSD. Most common specific heart disease, if they ask it, is TGA. And most common transient heart disease that occurs in IDM is hypertrophic cardiomyopathy. Most common cause of early onset neonatal sepsis is group B streptococci. Most common cause of myocarditis in pediatrics is Coxsackie virus. Okay, is it clear to all of you, those who are listening? There's nothing to stress out before the exam. These are very simple questions that can be asked. Maybe you get a direct question also from these 50 sets. So you should be well aware of these important one-liners that keep coming in the exam. Okay. Those who are understanding, you can leave a thumbs up for the session and we can keep moving ahead. We have set of 5 to discuss. So whenever you feel it is too much of one-liner revision for pediatrics, you can stop me. And if you feel that you should revise the complete set, then we can finish it off in an hour. Okay. Next question. Which is the most common complication of measles? Very commonly asked question in the exam. You must have come across this question in your MCQ books also. So, which is the most common complication that occurs in measles? And after that, also tell me which is the most common complication that results in death in measles. Both the answers. Most common complication क्या होता है और most common complication जिससे death हो सकता है in a case of measles. If anybody would like to answer this question, most common complication in measles is? Please type in your responses in the chat box. One infection that occurs very commonly with measles. You must have heard of it in your MCQs. The most common complication that occurs in measles is otitis media. Okay. Otitis media is one very common complication that occurs very easily in patients of measles. So because it involves your upper respiratory tract, it can lead to otitis media as well. Whereas the most important complication that can lead to death in a patient of measles is pneumonia. So post-measles pneumonia is a very dangerous state which can lead to very immense respiratory distress and hypoxia, and it can lead to death as well. Okay. So most common complication in measles is your otitis media, and the most common cause of death in a patient of measles is pneumonia. All right. Next question. Most common cause of sepsis and galactosemia. Very common question. Which organism is the most common cause of sepsis in a patient of galactosemia? So what should be the answer over here? Please type in the chat box. Whatever comes first inside your head, whatever you feel is the right answer, you can share that, because that is going to help you realize your reflex. So once you get the options, the golden criteria to come at the right answer is when you read the question, take a moment to reflect the answer in your brain. Whatever answer is reflected in your brain, if you have that in the option, that is definitely the right answer, because your brain responds to the reflex that you have already inculcated inside your brain while you were reading the concept. So if you get that as the first reflex and the same thing is in the option, that answer is absolutely right. So if I ask you this question, which is the most common cause of sepsis and galactosemia, can you recall any organism if you have read it ever? The galactosemia mein which sepsis is very very common? Which organism would you like to mention over here? तो गैलेक्टोसीमिया में क्या होता है? Three things that I would like to help you revise. Galactosemia presents with cataract. One thing commonly asked. It can present with acute liver failure. और क्या क्या होता है acute liver failure में? Infancy में you have tyrosinemia. Tyrosinemia में boiled cabbage colored odor होता है. And you also have fructosemia, that is fructose intolerance. And the organism which causes sepsis in galactosemia is E. coli. Okay, so please be clear. It is E. coli. E. coli is the most common organism that will cause sepsis in galactosemia. Alright. So these three are very golden points for galactosemia. All of you should be well versed with it. Cataract, acute liver failure, and E. coli sepsis. Okay, next question. Most common vasculitis disorder in childhood. So vasculitis disorders are very very famous in pediatrics. They can be asked very easily in your exam. So which is the most common vasculitic disorder that occurs in childhood? What should be the answer here? Which is the most common vasculitic disorder in childhood? Okay, I'll start to give you options also. Is it IgA nephropathy? Is it Kawasaki disease? Is it HSP? Or is it Takayasu? Now please tell me the answer. If you have read this, you can immediately recall it. Which is the most common vasculitic disorder in pediatrics? So it's a fast revision that we have to do before the exam. So please try to recall things and put in the chat box. Those who are listening, make an effort to recall it. This is going to help you exercise your brain before the exam also, so that you become super active and you can revise the whole pediatrics in an hour. So which is the most common vasculitic disorder? Even out of these options, if you had to choose, what would you go for? Anybody would like to guess? Which is the most common vasculitic disorder? Is it IgA nephropathy? Is it Kawasaki? Is it HSP? Or is it Takayasu arteritis? Now, out of options also, if you have to choose, which one would you go for? So, vasculitic disorder is very, very common in pediatrics, and the most common that occurs is HSP. So HSP is the most common vasculitic disorder that you see in pediatrics. In HSP, you get palpable purpura. It can present with your skin manifestations. It has got GI manifestation in terms of severe pain abdomen, and it has also got arthralgia and bone pains. Okay, so HSP is the most important and the most common vasculitic disorder that is present in pediatrics. Okay, next question. Which is the most common cause of short stature? Very simple question. Multiple times it has been asked in your exam. So what is the most common cause of short stature overall in the whole world, not only in India? So we see so many people are short heighted around us. So what do you expect is the most common cause of short stature? Yes, HSP is the right answer for that question. What is the most common cause of short stature? Is it any hormone deficiency? Is it constitutional? Is it any syndrome? Is it because of malnutrition? Which is the most common cause of short stature? So that is almost partially right. That basically means constitutional causes. Okay, so constitutional causes are the most common cause of short stature. So all the deficiencies that we read like pituitary problems, growth hormone deficiencies, Turner syndrome, all these are not the common causes of short stature. There are so many children who have short height. Does everybody have these kind of deficiencies and syndromes? No. So the most common cause of short stature is constitutional. Okay. After it is worked up that it is not constitutional, then you have to go and work up for hormone involvement. You have to work up for presence of any syndrome. You have to work up for any complex genetic syndrome which is associated with short stature. Okay, so constitutional is the most common cause of short stature. Okay, next question. Most common cause of increased knuckle thickness. So which is the disease which is very commonly associated with increased knuckle thickness? This is a very simple question. Where do you find knuckle thickness being increased? And where do we diagnose this condition with increased knuckle thickness? So, what is the most common cause of increased knuckle thickness in pediatrics? Mention two conditions जहाँ पे आपको increased knuckle thickness दिखती है. Yes, that's right. It is trisomy 21 where you find increased knuckle thickness. Okay, and that is also the most common cause for the same. Okay, so trisomy 21 is one important cause where we have increased knuckle thickness. Okay, all right, next question. Which is the most common cause of congenital infection? So congenital infection में कौन से होते हैं? Torch group of infections. So very simple. Out of the torch group of infections, which is the most common organism to infect? Which is the most common cause of congenital infection, which has got so many symptoms like microcephaly, chorioretinitis. It can cause SNHL, it can cause mental retardation, it can cause hepatosplenomegaly, it can lead to skeletal involvement as well. It can cause pneumonia, it can cause jaundice, it can cause thrombocytopenia. Which is the most common congenital infection in pediatrics? Intracerebral calcification. So many clues to help you answer. Please put it in the chat box. कौन सा टॉर्च इन्फेक्शन सबसे कॉमन होता है? एनी गेसेस? Yes, it is CMV infection. So out of large group of infections, CMV, that is cytomegalovirus, is the most common cause of congenital infection. So CMV is most commonly going to affect your multi-system involvement, and by far this is the most common congenital infections. All right. Okay, next question. Which is the most common cause of diarrhea in developing country? Please read the question carefully. It is asking about the developing countries. Most common cause of diarrhea, that means which organism causes diarrhea in developing countries most commonly. Please type in your responses in the chat box. Take a moment to recall whatever you have read. Definitely all of you must have gone through this topic. What could be the answer over here? So in developing countries, we all know E. coli, enterotoxigenic strain of E. coli is the most common cause that can lead to diarrhea. Okay, so please don't get confused. No other organism or any virus should be answered. It is E. coli that is very, very common for developing countries. Okay, had they asked only in infant, then your answer could have been rotavirus. They haven't put the infant age group in this, so rotavirus is not the most common cause of diarrhea in developing countries. It is E. coli. Okay, so E. coli has got many strains which is responsible for causing diarrhea. So out of all of that, E. coli has got one common strain that causes diarrhea in developing countries. Okay. Okay, next two important questions, very, very important. Please be careful. Which is the most common cause of pneumonia in newborn, and which is the most common cause of bronchiolitis in newborn? So, can you tell the organism for pneumonia and bronchiolitis both? Which is the most common cause of pneumonia and which is the most common cause of bronchiolitis? Yes, Streptococcus pneumoniae for pneumonia, that is group B streptococci. And which one causes bronchiolitis? Which one is going to cause bronchiolitis in newborns? Very commonly asked in your exam. Yes, for bronchiolitis, it is respiratory syncytial virus. That is your RSV, which is the most common organism that is going to lead to bronchiolitis in newborn. What is the treatment of choice for bronchiolitis? All one word answers, very prompt answers should be there. All your concepts should be very, very clear. So can you tell me the treatment of choice for bronchiolitis? One word, one treatment of choice for bronchiolitis. So for bronchiolitis, that one treatment that we should give is HHFNC. That is, you have to give humidified high flow oxygen through nasal cannula. So HHFNC is the treatment of choice for bronchiolitis. There is no role of giving any antibiotics. All right. Okay, next question, which is the most common cause of cyanosis in newborn? So if a newborn presents with cyanosis immediately at birth, which heart disease would you suspect? Which is the most common cause of cyanosis? Out of all the T series of disorders that we have discussed so far, which disease presents with cyanosis at birth? Yes, oxygen therapy is the right treatment for bronchiolitis, but then you have to go for high flow oxygen. So newborn में अगर cyanosis present है, then you have to be very sure that it is a severe condition and it is transposition of great artery. So TGA is the most common cause of cyanosis in a newborn baby. Okay. All right. Next question. Very important question. Which is the most common preventable cause of mental retardation in India? So one simple condition which can lead to mental retardation if it is undiagnosed in newborn age group, and because of which we also have got started the screening for this disorder in the newborn age group. So which can lead to mental retardation, and it is the most easily preventable cause. That means the treatment is well presented and we can easily start the treatment as well. The most common preventable cause of mental retardation in India is स्क्रीनिंग भी इसकी शुरू हो चुकी है and we take the umbilical cord sample for this disease. TOF presents usually beyond infancy. If TOF is to present at birth, it should be associated with very critical pulmonary stenosis or complete component of pulmonary atresia. Otherwise, TOF classically presents after 1 year of age. Answer to this question, mental retardation, most common preventable cause. Yes, it is congenital hypothyroidism. So congenital hypothyroidism needs to be prevented because it can lead to mental retardation. तो इसके लिए हम क्या करते हैं? We do umbilical cord blood sampling and we estimate the level of TSH and we have to potentiate the treatment as soon as possible. Okay. Next question, which is the most common cause of portal hypertension in children in India? So which is the most common cause of portal hypertension? Which is the most common cause of portal hypertension in pediatrics in India? What is the right answer over here? Most common cause of portal hypertension in children in India. So most common cause that leads to portal hypertension is EHPVO. Okay? That is your extrahepatic portal vein obstruction that will lead to portal hypertension in pediatrics. Okay? So this is the most common cause. Next question, which is the most common cause of croup? So croup is a very common respiratory condition that we all should be aware of. So which is the most common cause of croup in pediatrics? Which organism is the most common cause of croup in pediatrics? The croup is most commonly caused due to a virus. The croup is most commonly caused due to para-influenza virus. So it is para-influenza virus which is the most common cause of croup in pediatrics. Okay. So please remember the name of the organism. It is very very commonly asked. Croup का organism क्या है? Bronchiolitis is caused because of which organism? Pneumonia किससे है? Diarrhea किससे है? So all these organisms become very very important if they lead to a widespread disorder. Okay. Next question, which is the most common cause of pneumonia in HIV positive children? So immunocompromised में pneumonia का most common organism क्या है? Which is the most common cause of organism in HIV positive patients which can lead to the presentation of pneumonia? So whenever we are dealing with immunocompromised state, you should always be aware of atypical organisms, especially in diarrhea and pneumonia both. So in this, it is most commonly caused due to Pneumocystis jirovecii. That is right, Pneumocystis jirovecii. Okay, so this is the most common organism that is responsible for causing pneumonia in HIV positive patient. All right. Diarrhea also has got many organisms like Cryptosporidium, Isospora. So all these atypical organisms are very very common in immunocompromised children. Next question, which is the most common cause of congenital nephrotic syndrome? Or you can also tell me the mutation that is associated with congenital nephrotic syndrome. Schistosomiasis is not the organism for that. What is the cause of EHPVO? Basically is the most common cause because it can go and obstruct your portal vein, any kind of etiology in your abdomen which can obstruct the portal vein apart from your hepatic causes. So it is extra hepatic portal venous obstruction. So it can be any organism, any infection, like especially in newborn age group. One example you should remember, that is umbilical cord catheterization. Okay, अगर umbilical cord catheterization हो रही है, many a times it can lead to obstruction. ठीक है, न्यूबॉर्न एज ग्रुप में ही है. इसके अलावा एनी इन्फेक्शन लाइक अपेंडिसाइटिस, pancreatitis as well, any infection, any etiology, any kind of newborn problems or early age problems like neoplastic diseases, myeloproliferative disorders, anything can lead to the obstruction which can lead to portal hypertension. So you just have to be sure it is not related to the cirrhotic causes which that is associated with liver. So if it is extra hepatic, then all of these causes can lead to portal hypertension. So congenital nephrotic syndrome में क्या होता है most common? Which mutation is responsible for it? So in congenital nephrotic syndrome, NPHS1, okay, NPHS1. This is the most common mutation that is associated with your congenital nephrotic syndrome. You have got Finnish type of congenital nephrotic syndrome, okay. So these are all the common one-liners that all of you should be aware of. So please be very sure about the organism. The name of organisms are very commonly asked in the exam. Okay, next set of 5 questions. Which is the most common cause of orbital calcification in pediatrics? So where can you find out orbital calcification? Or any classical reason that you see in cases of orbital calcification? What should be the answer over here? Please type in your responses in the chat box. Most common cause of orbital calcification is, तो white reflex वैसा कब दिखता है हमें? Obviously, if calcification is present, it is to do with malignancy. So which orbital malignancy is very commonly associated with calcification? It is retinoblastoma. Okay, is retinoblastoma that is very commonly associated with presentation of orbital calcification. Okay, most common type of TEF, that is tracheoesophageal fistula, is, so out of all the type, which is the most common type of TEF? Please ponder upon the question once and try to recall whatever you have studied till now so that you understand what is being asked. जो भी reflex आपके दिमाग में सबसे पहले आता है, that should be the right answer. So which is the most common type of tracheoesophageal fistula? Please type in your responses in the chat box. Any guesses from anybody? Which type is the most common type? So we have got type C, जिसमें proximal end आपका blind होता है and the lower part has got a connection leading to the fistula. So type C is the most common type of TEF that is seen in pediatrics. Yes, that is esophageal atresia with distal TEF. That is the most common type. Next question, which is the most common cause of gross hematuria in pediatrics? Very commonly asked question, must have been asked hundred of times. So most common cause of gross hematuria in pediatrics is, whatever reflex comes to your mind, please type in the chat box. Don't hesitate to type the answer. So this is just a recall session that we are having so that we can fastly revise the simple one-liner questions in pediatrics. And I hope you get plenty of these in your exam. Which is the most common cause of gross hematuria in pediatrics? There's only one very common example, classical example for gross hematuria. What is it? So it is IgA nephropathy. Okay. One example that you should all remember for your lifetime. Don't ever get confused. Gross hematuria का सिर्फ एक ही आंसर आपको करना, that is IgA nephropathy. So IgA nephropathy is the most common cause of gross hematuria in pediatrics. Okay. Next question, which is the most common cause of congenital hypothyroidism? Pyelonephritis has not got gross hematuria. It can have hematuria as a complication, but that is not gross hematuria. Okay. Gross का सिर्फ एक ही classical example है, that is IgA nephropathy. Even Alport's has got hematuria to a lot of extent, but most common cause is IgA nephropathy. So which is the most common cause of congenital hypothyroidism? So if a newborn has got congenital hypothyroidism, which is the most common cause? अगर थायराइड हार्मोन ही नहीं है तो क्या हो सकता है मोस्ट कॉमन कॉज? So if the thyroid has not formed properly, it will not be able to produce the hormones enough. So it is very simple. It is thyroid dysgenesis. Dysgenesis is more common than complete agenesis. So please remember, thyroid dysgenesis is the most common cause of congenital hypothyroidism in pediatrics. All right. Which is the next question, most important risk factor for NEC? That is your necrotizing enterocolitis. Which is the most common cause of NEC? One risk factor that is the most predisposing factor that the baby can develop necrotizing enterocolitis is so one risk factor that is there present for all the important complications of newborn is prematurity. So please remember, prematurity is the most important risk factor. Agar premature है baby, then he can have a lot of complications, and all these complications like NEC, IVH, RDS, low birth weight means prematurity indirectly. So prematurity you should be very sure of. अगर necrotizing enterocolitis है, intraventricular hemorrhages है, respiratory distress syndrome है, and PDA है, patent ductus arteriosus. These four are classical four examples of premature or preterm side effects or preterm complications that can occur. ठीक है, so preterm or premature baby is the most important risk factor for NEC to develop. Okay. Alright, next question. Most common neurological defect in infant of diabetic mother is? It is asking most common. Which is the most common neurological manifestation or defect that can occur because of diabetes? Very commonly asked question. Which is the most common neurological defect in infant of diabetic mother? It is neural tube defects. Okay? So entities which are the neural tube defects are the most common defect which can occur from neurological point of view in an infant of diabetic mother. Most common bone, next question. Most common bone to get fractured in a newborn is? So at the time of delivery of the newborn, which bone is at maximum risk to get fractured? If you develop complications like shoulder dystocia, then which bone can get fractured easily? So it's a simple common sense also to use. You guys can easily answer it. The most common bone that gets fractured is the clavicle. Okay, so clavicle gets fractured very easily because of complications of normal delivery also. So if it is not pulled out properly, there's macrosomia, then all the pressure goes onto the clavicle and it can get fractured. Okay, next question, which is the most common type of atrial septal defect? So we have got many types of ASTs like ostium primum, secundum, sinus venosus. So which one is the most common type, which actually accounts for the AST picture? Which is the most common type of AST? So it is ostium secundum. Yes, that's right. It is ostium secundum. Okay. OS type or ostium secundum type is the most common type of AST that is present. Okay. Next question. Most common bone to be affected in LCH is? So Langerhans cell histiocytosis में which bone is very commonly affected? So once you read about LCH, there are many systemic manifestations that occur in LCH. So which is the most common bone to be affected in Langerhans cell histiocytosis? So it is the skull. The skull is very commonly affected in Langerhans cell histiocytosis. There are many manifestations like seborrhea, there is hair fall also, the bones also get deformed. So it can lead to a lot of lesions and it most commonly involves the skull. Okay, next question. Which is the most common solid extracranial tumor in children? So extracranial most common solid tumor, midline tumor that occurs, space occupying tumor, what should be the answer over here? Most common solid extracranial tumor in children is? It is neuroblastoma, right? That is neuroblastoma. Okay? So neuroblastoma is the most common extracranial tumor or solid tumor that occurs in pediatrics. Okay, next question. Most common virus causing diarrhea. So the answer to virus becomes rotavirus, as you have already mentioned that. So most common virus causing diarrhea in pediatrics is rotavirus. That is right. Next question. Most common extraintestinal manifestation in celiac disease is? तो एक्स्ट्रा इंटेस्टिनल मैनिफेस्टेशन में सबसे कॉमन प्रेजेंटेशन क्या होती है सीलियाक डिजीज में, which is commonly seen in almost every patient of celiac disease, or they can even present with this presentation if they have got celiac disease. It is not necessary that they always present with loose stools. So extra intestinal manifestation in celiac disease is? So most common, yes, that is iron deficiency anemia. So iron deficiency anemia becomes the most common extraintestinal manifestation in celiac disease. Next question, most common site for cardiac myxoma is? Where does cardiac myxoma occur most commonly? Which is the most common site for cardiac myxoma to occur? So out of all the chambers, it most commonly involves the left atria. So left atrium is the most common site for cardiac myxoma to occur. Alright. Next question, which is the most common cause of pyelonephritis in children? So pyelonephritis is basically the infection of the urinary tract. So it is a simple common sense question. If somebody is having recurrent episodes of pyelonephritis, means there is some kind of problem that is leading to recent onset of infection every time. So most common cause of pyelonephritis, please don't mark anything else. It is vesico-ureteric reflux. Okay? So VUR becomes the most common cause. Sacral agenesis, yes, that is a specific answer, but if you get that, you can mark it. Otherwise, neural tube defects would be a broader answer for the same. Okay? So vesico-ureteric reflux becomes the most common cause of pyelonephritis in children. Okay, next question. Most common infectious cause of adrenal insufficiency in children is, which is one organism that results into infection and causes adrenal insufficiency in children. So one disease which is responsible for causing sudden adrenal insufficiency or adrenal shock, as we call it as adrenal shock, कौन सा organism होता है? Yes, that is meningococcemia. Okay, meningococcemia is the right answer. So meningococcemia is the organism that results into sudden adrenal shock features. Okay. Alright, most common type of cerebral palsy is, out of all the types, which is the most common type of cerebral palsy that occurs? Come on, type your answers fast. Which is the most common type of cerebral palsy? It is spastic diplegia. Okay, spastic diplegia is the most common type of cerebral palsy that occurs in pediatrics. Next question, which is the most common type of diabetes in children? So pediatrics mein most common type of diabetes is type 1. No confusion about it. Type 1 DM is the most common type of diabetes that occurs in pediatric age group. Okay. Next question, most common congenital anomaly of GI tract is? So there is a lot of doubt about this question, but if we see it incidence wise, the most common congenital anomaly in the GI tract, if you include the newborn and the infant age group, right at presentation, it is Meckel's diverticulum. Okay? So Meckel's diverticulum is the most common congenital anomaly of the GI tract that occurs. if we consider it incidence wise. So please don't get confused with this question. You should answer it as Meckel's diverticulum. Most common type of intussusception is? Which is the most common type of intussusception? Very simple. Those who are listening, please type in your answers in the chat box. The most common type of intussusception is ileocolic. So ileocolic is the most common type of intussusception that occurs in pediatrics. Next question. Most common location of pilocytic astrocytoma is? Most common location of pilocytic astrocytoma is? कहाँ पे मिलता है हमें pilocytic astrocytoma? It's a very classical tumor and it is in cerebellum. Okay, so cerebellum is the most common site for pilocytic astrocytoma. Okay, next question. Which is the most common cause of acute surgical correction in children? So acute surgical presentation that occurs very commonly in pediatrics is? Acute surgical presentation that can occur in this age group. So pediatrics में most commonly it is acute appendicitis that presents with acute surgical emergency. ठीक है, sudden onset of pain, abdomen and infective appendicitis is the most common cause of acute surgical emergency in pediatrics. Okay, next question. Most common cause of neonatal intestinal obstruction is? So if a neonate has got intestinal obstruction, which is the most common cause? So if the intestinal obstruction is present, it is because of meconium plug. So meconium plug is very common in newborns. It is not a pathological condition. However, if it is present, you can suspect cystic fibrosis in these patients. But meconium plug syndrome is the most common cause of having acute obstruction in the intestine. All right. Next question. Most common cause of acquired hypothyroidism is? So if it is an acquired hypothyroidism, what is the most common cause? Please type in your answers, those who are listening. Acquired cause में which is the most common cause? Yes, meconium plug is the right answer. So acquired में most common cause is Hashimoto thyroiditis. ठीक है, Hashimoto thyroiditis is the most common cause of acquired hypothyroidism. Okay. Next question, which is the most common cause of hydronephrosis in a newborn? So if a newborn presents with hydronephrosis, what could be the cause? Obviously, it has to be congenital. So any kind of obstructive uropathy can lead to that. And what is seen commonly? UPJ obstruction. So UPJ obstruction is a uretropelvic obstruction, junction की obstruction, or even vesicoureteric reflux could be the answer to this. ठीक है, so in newborn में hydronephrosis presentation means congenital defect. There can be obstruction at the junction of the uretropelvic junction. ठीक है, most common cerebellar neoplasm in children is? Cerebellar neoplasm कौन सा है most common? So cerebellar neoplasm में क्या आते हैं? मोस्ट कॉमन अगर पूछा जाए देन इट इज मेडुलोब्लास्टोमा. ठीक है, तो posterior tumors very common. Medulloblastoma is the answer to most common cerebellar tumor. Okay, so that is I think the last slide that we have for today's class. Last set of 5 important most common in pediatrics. Most common site of coarctation of aorta is? The coarctation of aorta occurs most commonly at which site? So it is juxtaductal. Juxtaductal is the most common site where coarctation of aorta can occur. Alright, most common cause of stridor in young children is. So, next question, which is the most common cause of stridor in young children means in infants basically, not school going or older children. So, young children, में most common cause of stridor is. It will resolve on its own. What is the answer? It is laryngomalacia. So noisy breathing can be a very common complaint with many newborn babies, but if you examine, they only have a very normal condition known as laryngomalacia, which will also go beyond infancy on its own. Okay, next question. Which is the most common cause of idiopathic nephrotic syndrome? So idiopathic nephrotic syndrome का most common cause क्या होता है? Yes, if it is infants, it is laryngomalacia. If they have not specified the age group specifically, and you get school-going children or normal children, then you can suspect it is foreign body. So idiopathic nephrotic syndrome में most common होता है minimal change disease. So MCD is the most common type of idiopathic nephrotic syndrome. All right. Next question. Most common cause of congenital adrenal hyperplasia is. So which enzyme is most commonly associated with CAH? Yes, that is 21-OH deficiency. So 21 alpha hydroxylase deficiency is the most common enzyme that is associated with presentation of congenital adrenal hyperplasia. Last question, most common cause of renal artery stenosis is? What is the most common cause of renal artery stenosis in pediatrics? One disease that we all are aware of. So renal artery stenosis, yes, that is Takayasu aortoarteritis. ठीक है? So that comes towards the end of 50 questions of the most common in pediatrics that we have discussed so far. So it was a very fast revision, whatever we could do best in the last minute. So thank you all of you for listening so patiently. I hope all of those who are listening is ready and prepared for the exams. So thank you for being so patient. You can leave a thumbs up if you like the session. And I guess that most of you are those who are preparing for the next year's exam, I believe. So you can leave a thumbs up if you understood the session. So in the last minute, please stay calm and do not panic anybody. So everybody has studied whatever they could do to the best of their extent. So whatever you have studied, just be confident about yourself and please do not panic. Whatever you have read till now is more than enough for you to do wonders in your exam. So from Unacademy, we have Bugs Bounty as a feature. You can also report any inappropriate content that you find. If you have not started to follow the Telegram channel, please follow us on Telegram by the channel name of Let's Crack NEET PG, where you get all the updates for the same. And those who want to study further pediatrics for the upcoming exam, please come and subscribe with my code, that is Kavita S10. So if you use this code, you can unlock all the special classes on Wednesdays that I'm taking. On Wednesdays, whatever special classes that I'm taking, you can attend it for free if you use my code to unlock the class, that is Kavita S10. Okay, so this Wednesday we are going to hopefully start with the new unit in pediatrics. Most likely we are going to start up with nephrology. Okay, so nephrology is very, very important. We'll deal with all the congenital disorders, all the acquired disorders. So please attend the classes on Wednesdays so that you can complete your unit along with the topics that I'm teaching. And those who want to attend the complete pediatric session for the next year's upcoming exam with me, please take the plus subscription. Kindly use my code, that is Kavita S10. If you put down this code, you get 10% discount also, and I can meet you on the plus hours so that we can prepare nicely and we can target the next year's exam with a lot of confidence. So whatever topics that are there included in your general pediatrics, your systemic pediatrics, neonatology, and your social pediatrics and mental health in pediatrics, all of that would be covered by me. So if you want to learn it and you want to see any of the sample videos, you can go through cardiology unit, which I've already taken on the YouTube classes. So please go through the sample videos, just see whether you're able to understand, if you like the way of teaching and you feel that yes, most of the units can be covered nicely. So please take the plus subscription so that we can speed up our pediatrics unit and we can start to prepare nicely for the upcoming exams. So this month I would be finishing off nephrology and central nervous system, that is neurology. So two very very important topics and two very very important things to read for your exam. So all of you start following the YouTube channel. Please listen to YT classes. Please attend the special classes on Wednesdays with the use of my code. And also if you want to learn the complete pediatric syllabus from me, please subscribe as soon as possible. So thank you all of you for listening so patiently. I hope all of you are doing good. Stay healthy, eat healthy, sleep well, and all the best to all of you for the exam. Nothing to worry about. It is just a phase of life. All of you will come up with flying colors. So all the best to all of you. And I hope that those who are preparing for the next year's exam would be able to meet me again in the next session. And those who are very